Let us talk about the extensor compartment of the leg, the muscles of it. In this, you are supposed to know the four muscles, and these include tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis tertius, also called peroneus tertius, sometimes also called brevis, fibularis brevis or peroneus brevis. For each of the muscles, you are supposed to know the attachments, functions, and innervations. For the discussion of this component of the lecture, I will be moving on to the 3D model, 3D for medical, and we will discuss their attachment, their functions, and their supply. So let us talk about tibialis anterior muscle. Simply speaking, it originates from the medial aspect of upper tibia and inserts into medial aspect of foot. Let us dive a little deeper. Here you can see that it is originating from the upper part or upper two-thirds of the lateral aspect of tibia, not the medial aspect, my apologies. It is arising from the lateral condyle, infralateral surface of the lateral condyle, and from the adjoining part of interosseous membrane. So this is the muscle that is originating. Let us follow its tendon and we reach about here. And here we see that it is inserting into the medial cuneiform and the first metatarsal bone, these 2 points that are visible here. So it is attached to inframedial surface of the medial cuneiform and the adjoining parts of the base of the first metatarsal. So these are its origin and insertion from the lateral aspect of tibia, upper two-third, lateral condyle, interosseous membrane, and head cuneiform and the first metatarsal. So what are their functions that this muscle is going to do? As you can see, it is this tendon is moving in front of the medial malleus, in front of the ankle joint. So when this contracts, it just pulls the ankle joint. It just put the toes upwards. That is called dorsiflexion of the foot. So it is the muscle that is majorly responsible for the dorsiflexion. You can put your hand on the front of the ankle and dorsiflex. You will be very well easily able to palpate this tendon. The second function, it pulls the medial border upwards. When the medial border is pulled upwards, what happens? If you pull the medial border upwards and the lateral border remains down, this is called inversion. So it is one of the major muscles of inversion. Two functions. Number three, when it pulls the medial border upwards, it helps in the maintenance of medial longitudinal arch. So this tendon pulls it up, so this arch maintains. So if this muscle is paralyzed, this will become relatively flattened. So these are its three functions that we are going to memorize. Ankle dorsiflexion, inversion at the septalar joint and TCN joint, and the maintenance of the medial longitudinal arch. And this muscle and will along with all the muscles of extensor compartment are supplied by the deep peroneal nerve. Okay, then let us move on to the next muscle, that is extensor hallucis longus. So this muscle arises from right here. As you can see, it arises from here. It arises from the middle part of the fibula. You can say middle third of the fibula, you can say middle two-fourth of the fibula, both will be considered right. And then as you can see, it goes on to insert right here. It goes on to insert this distal phalanx of the big toe. So it goes on to insert on the distal phalanx of the big toe. If I remove the muscle again, you can see this is the insertion point. So it inserts into the distal phalanx of the big toe. So keeping these attachments in mind, what will be their functions? Here you can see its insertion. So its major function will be to extend the big toe. So at its flex, so this is where it will get active. So its primary function will be to extend big toe at distal interphalangeal joint, but when that muscle at that point reaches its end, it will indirectly help in extension of metacarpophalangeal joint, and when that is played out, it will help in dorsiflexion of the ankle joint. So these are the functions of the extensor hallucis longus. So that is the extension of distal interphalangeal, extension of metacarpophalangeal and metatarsophalangeal, my apologies, and the extension of dorsiflexion. And each subsequent proximal joint will be incorporated when the distal one is played out, or the flexor muscles of that joint does not allow that to. So if the muscles of the interphalangeal joint are taut and extensor muscle is contracted, then the action will be transferred back to the metacarpophalangeal joint, and so all the way back to the ankle. So that was about the extensor hallucis longus, and its nerve supply is again the same, deep peroneal nerve. And one thing about its the running direction will keep come in handy when you are discussing the vessels. See, the tibialis anterior was running downwards from its point where it was originating. This digitorum will almost go to this part as it going down, but the extensor hallucis starts from the lateral aspect and it goes to the medial aspect, so it crosses from lateral to medial. So this crossing will become important because in this way it is going to cross the arteries and veins that are going behind it. Keep that in mind when we are discussing the arteries and veins of this topic. So a very quick revision of the muscle: from the middle one third of the medial surface of fibula, attachment to the distal phalanx of big toe. Function will be to extend in order interphalangeal, metacarpophalangeal, then dorsiflexion of ankle, and innervation by deep peroneal nerve. And the thing that I wanted you to remember was its oblique running of the course from lateral to medial aspect. Let us move on to the next muscle. Extensor digitorum longus. It has an extensive origin. It originates, as you can see, it originates from the lateral condyle of tibia, then it starts from the head of fibula and then shaft of fibula, upper part, middle part. So upper three-fourths basically of upper three-fourths of fibula that are giving origin to extensor digitorum longus. So this is a big bellied muscle and it goes down, and as it goes and crosses the ankle, it divides into four parts, each one going one of the lateral toes excluding the big toe. And it has a interesting rather in its insertion. As you can see, as it gets inserted, it splits into three parts. Let me draw. So when it comes here, the tendon approaches the insertion point, it splits into three parts, 1, 2 and 3. The middle one get inserted into the middle phalanx. The distal one goes and they join one another and inserts into the distal phalanx. And this is the basis of formation of the extension and expansion, and these points give attachment to the lumbricals and the interosseous muscles. Let me show you right here. So this is how they are visible. There are other pictures available too, but that's to give you a basic idea. Now let us move on to it discussing its function. As you might have guessed already, so they are responsible for extension of the big toes of the all the toes other than the big toe. So this is the flexed position or plantar flex position. So this is called the dorsiflex position. This is brought about by extensor digitorum longus, and as opposed to the hallucis longus, these movements are on both distal and proximal interphalangeal joints because it is attaching to both, and then by extension it can go on to include the proximal joints including the metatarsophalangeal joint, and by extension I mean apart from interphalangeal joint and metacarpophalangeal joint, again like hallucis, it will be responsible for dorsiflexion of the ankle or simply the extension of the joint. By the way, do not get confused. Simple flexion at ankle is the plantar flexion. Simple extension at the ankle is dorsiflexion. So that was about extensor digitorum muscle. So we talked about its origin. It started from lateral condyle of tibia, head of fibula, upper three-fourths rather of fibula, shaft, and then it got inserted into the middle and distal phalanges, as we saw right here. As we saw here in the okay, of the phalanges, and then we talked about its function, and in the function we saw that their function will be to uh, extend the joints at interphalangeal and metacarpophalangeal, metatarsophalangeal, and dorsiflexion at the ankle joint. That leaves us with one muscle. For that muscle, let us zoom into the lower aspect. So here, as you can see, the muscle origin and insertion. So this is the origin point, lower 1/4 of the medial surface of shaft of fibula and adjoining surface of interosseous membrane. And from here, if we follow the muscle, as you can see, it is going to be inserted on the it is going to be inserted onto the dorsal aspect of base of fifth metatarsal. As you can well guess from its position, let us go through its functions. Running in front of the ankle joint, so when it contracts, it will help in dorsiflexion of the foot. So it is a dorsiflexor like all of the other muscles of the anterior compartment. And as it is attached to the lateral margin and it pulls that up, so it will help in E version of the foot where lateral margin rises up. So it is helping in E version of the foot. Last but not the least, it pulls the lateral end up. So it is basically helping in keeping the lateral arch intact. So it is helping to support the lateral longitudinal arch. So it will have three functions. And the maintenance of lateral longitudinal arch. So these are the functions that are done by peroneus tertius. So with this, we have discussed all of the muscles of the anterior compartment. There were tibialis anterior, there was had extensor digitorum longus, extensor hallucis longus, and peroneus tertius. All of these you can go through. There will be such table in any of your textbook. This one is from the Snell's anatomy. You can get a more detailed version in the BD Churasia and KLM. But you have to be very clear about which bones they are attached, even if you don't know the minute details, and you have to be very clear about the functions that are provided. And let's go through the common things. All of these muscles are supplied by the deep branch of common peroneal nerve. All of these muscles are responsible for dorsiflexion at ankle. The two muscles that are attaching on the medial aspect, extensor hallucis and tibialis anterior, will be responsible for inversion, with tibialis anterior being the major one. The muscle on the lateral aspect, that is peroneus brevis, will be involved in eversion, and extensor digitorum will have a function in both inversion and eversion depending upon which parts are contracted. And last, the medial muscles will be responsible for maintenance of medial longitudinal arch, and lateral muscle will be responsible for maintenance of lateral longitudinal arch. We are left with extensor digitorum brevis that we will discuss in the dorsum of the foot. So that's it for the muscles component. Now in the next component we will discuss inshallah the artery and the nerve of this compartment. If you have any suggestion, question, suggestion and feedback, please let me know. Thank you so much.